Thank you. A question from here in the audience. I'll just paraphrase it once more. For those who suffer from trigeminal neuralgia, is there any news out there that is hopeful for them?
So, I mean, the mainstay treatment for trigeminal neuralgia has been...
Maybe, Dr. Mott, if I could just ask you to perhaps give a two-sentence description, that might be helpful for...
Some patients with MS have sharp shooting, jabbing pain in the face, one side of the and these this can be quite limiting, quite debilitating, and the patient may have problems touching the face, brushing, washing, and even eating at that time. So it can be quite debilitating, and this entity is called trigeminal neuralgia. And the mainstay of treatment over the years has been a drug called carbamazepine or Tegretol. Other anti-seizure drugs like Tegretol help as well. And so gabapentin, Lyrica, these are other agents that help. There have been a host of other drugs that have been tried for this, and very rarely, if the situation is the right one, in other words, you don't have any other medical problems and so on, I have sometimes sought advice from a neurosurgeon to see if one of the neurosurgical procedures can help. So in other words, some sort of procedure that attacks the trigeminal nerve and gets relief from that. There are some reports even of Botox treatment for trigeminal, and so, but the main status is carbamazepine or Tegretol.
This question has come forward. How can I sign up to be a part of a clinical trial for CCSVI or any of the other drugs?
For CCSVI, I can really only speak to our own research. And the current diagnostic BC-SASC study is by invitation to patients in the Canadian Collaborative Genetics Study because we're looking especially at those twin and SIB pairs. So we're looking at people from whom we have blood samples, and we're looking at HLA identical pairs. For that study, there's no signing up. And for future studies, potential future studies, the enrollment process has not yet been defined. And I'll let you speak to the pharmaceutical.
Sure. So in our province, Nova Scotia, MS care is pretty much centralized. It comes from the clinic in Halifax, our clinic, and we have a satellite clinic in Sydney, but we collect data from there as well. So all of this data goes into a database. And you should recognize that most, in fact all, MS studies have certain inclusion criteria. So a steering committee determines that what duration, in what age range, what type of MS, and what EDSS score, and so on and so forth. And when that happens, all we got to do is click a few buttons and we can get out who is a candidate, and then we approach you. So in a sense, you're all candidates. I'm talking about my patients in Nova Scotia, and I'm hoping other provinces may have similar databases. But you're in Nova Scotia, you're all potential patients, depending on what the inclusion criteria are.
I think maybe in other places, the first step would be to approach your treating neurologist. And if your treating neurologist is not part of an MS clinic that is typically involved in clinical trials, to ask for a referral to a clinic that might be involved in pharmaceutical trials. Would that be fair to say? So.
Sure.
Great, thanks. There's a question looking for more information on the status of the trials involving minocycline. Why is it that all of those studies seem to be in conjunction with one of the existing therapies? Shouldn't this be studied as a standalone therapy? So I think we'll need a little bit about minocycline and state of the nation.
So minocycline is an antibiotic that's been around for about 30 years, if not longer. It is commonly used out there for acne. It has some effects on what are called matrix metalloproteases, certain chemicals that are known to be harmful in MS, and therefore the idea came that maybe a cheap drug like minocycline might do the trick, might help in MS and might do the same things what the interferons in Copaxone does, yet it's an oral drug and it's taken once or twice a day. So some preliminary studies on this were done in Calgary by Dr. Metz and Dr. Wee Young. And in the animal model and in a very small patient study, there was some early hints that perhaps there may be some suggestion that this drug works. And so the MS Society actually gave out a fairly decent-sized grant to Dr. Metz and to collaborators across Canada to study minocycline. So we are actually studying it as we speak. And the study is called Minocycline in CIS, in clinically isolated syndrome, because we felt that this drug may have the most benefit in the earliest stages of multiple sclerosis. And I think in conjunction with interferons may be a misconception out there, because what we did was to make it ethically correct. In this patient of minocycline in clinically isolated syndrome, if during the course of the study a patient has an attack, they are given the chance to go on one of the standard therapies. Because if we don't know whether minocycline is working or not, we don't want to restrict patients to a drug with unknown efficacy for 2 years without giving them an escape clause, so to speak. And that's where the confusion comes from. So yes, it's being studied as we speak.